Hello everyone. Viewers, today we have a cricketer amongst us. He is between amateur and professional cricketer. He still is playing really like on a regular basis. He trains and plays. And then what happens is he's a fast bowler, and because of that he's suffering from low back pain and more specifically SI joint, yani sacroiliac joint pain, and that's probably because of his bowling action, and that is also radiating upwards to his mid thoracic spine. तो उनका जो पूरा पीठ है इवन इंक्लूडिंग लो बैक और कमर के हिसाब से पूरा दर्द है. तो हम पूछते हैं उनसे कि कैसे हुआ, कब हुआ और कितना दर्द है उनके पास. So could you explain a little bit as to when it started, how long it has been, and the extent of the pain intensity?
So the thing is, I felt this pain while bowling itself. So like when I started bowling, it's not that much, and once I gradually bowl and bowl, so it becomes much more. So this is one pain, and I'm a right arm fast bowler. So I'm feeling the pain exactly on my opposite arm's back.
Correct.
So probably due to my bowling action or my placing of the foot.
Correct.
So the thing is, the rate of the pain would be somewhere around 6 to 7 ish.
6 to 7 out of 10.
Yeah, and fortunately, since the last 1 week or so, the pain has reduced a bit, but it's still there.
Correct. Correct. And has it hampered your activities on daily living in overall?
To some extent, activities I do after practice, it has hampered a bit, but not much.
Not much. So I know that you are studying engineering and also when you are focusing on your studies, it's not. So long-standing sitting and all is not bothering you.
Not that well.
Correct. So it's only after that you bowl, after
I
about 5, 3, 4, overs of throwing the ball, then the pain starts.
Exactly,
Alright. So let's see if we will test his SI joint a little bit and let's see how much we can relieve his pain today. Alright. So bane rahiye hamare sath. Thank you, viewers. And then come up and let us know where you are feeling the pain.
While bending also I am feeling this pain over here.
Okay. So right over here.
Right over there.
So 1 second, let's mark where your pain is. Okay, thank you. And then while coming up, do you still feel the pain?
Yeah, at this
point.
Yeah, at this point I feel
And then it's in the same position.
Yeah, exactly.
Okay, so same position in both sides when you are bending forward and coming back up.
Yeah.
So you are having
Angular
pain.
angle, yeah.
Correct. And then could you extend yourself a little bit? Any problem? Any pain?
No.
No, nothing. Alright. So lie on
Little bit
your.
of pain while I'm just doing this.
Okay.
This angle, little bit of pain. That's
Okay.
it.
What about when you are coming up?
Yeah, while I'm coming up only, I'm telling.
Okay.
Yeah.
So it's a problem with eccentric control of the muscles, and the point where he is showing there are actually not many joints in here. It's the origin of or insertion. It's one of the attachment points for erector spinae. So it is highly likely that the left side erector spinae right over here is probably weak, and that is causing strain during his bowling action, which is because his right side is hyperactive. And we will see how we can reduce this issue also. Alright, lay on your belly real quick. Okay, straighten your leg and then raise it from your hips. The right one. Alright, perfect. And the left one. Yeah, lower it down, and the left one is right now. Okay, so that's basically it. This is how much he is able to lift with compared to the right, which was over here, and the left is so down. So let's see if we can correct this problem, and by that if we are able to eliminate the pain or not. So our testing is essentially done. What he has is not much of an SI joint issue, but we will certainly realign and adjust the left SI joint, and we will also correct the lumbar spine, especially the L5-S1 junction, but we will more focus on the erector spinae trigger point where he has actual pain. So we will start the treatment, right? तो हमारे साथ बने रहिए दर्शकों. So fantastic. Lower yourself. We'll do a little bit of sacral rocking. All right. We will do adjustment. All right. Turn towards me, please. Turn towards me. Okay. And slide your hips towards me, both the hips. Okay. All right. Hold on to your triceps. Look towards the sky. Done. And then turn towards the other side. Slide your hips. Fantastic. Lower leg actually straight. Straight. Sweet. Hold it. This will be at a different angle. Okay. Done. Relax. Let's check. Fantastic. Your both ankle joint is looking exactly the same in terms of the length. We'll do a little bit of a traction. So slide your hip joint. Slide your hip joint to the right. Oh, nice. That was a good home run. Good. All right. So turn on your belly one more time. Raise your left leg. Keep it straight. Yeah. Raise. Raise. Raise it. Keep it raised. Keep it raised. You can do it. Come on. Keep it raised. Lift it. Lift it. Raise it more. Alright, relax. Relax. Raise this guy. So round about here. Raise the left one. So now you saw compared to the right what it was and where this left leg is. How much he was moving before, which was way lower. Now it has increased like incredibly. Right? So lower it down. We'll do a little bit of a strain counter strain measure just to relieve and release the ES or erector spinae, especially iliocostalis. That's exactly where his problem lies. दोस्तों हम लोग ट्रीटमेंट कर लिए, अभी देखेंगे उनका दर्द का लेवल, पेन का लेवल कैसा है. So we will ask him to bend forward, the exact same test that we did, bend backwards and check. Initially it was 5 and 6, 5 between 5 and 6. So we will do the test and let him ask, and then let's see what happens. So आगे you bend forward. Let us know.
At this point, I feel a little bit of pain, but it is much less than what I was feeling before.
So how much would you categorize from 6 to now?
Almost at 2.
Almost a 2. Okay. And how about when you are getting up?
Getting up, same.
So about
point,
2. About 2. And then how about, yeah. So from 6 to 2.
Yeah.
And this one, is it the same or?
This one is almost at 2.
Almost at 2.
Yeah.
Okay. So पहले उनका 6 पेन था, now it's 2, which has reduced by 4 points or 40%. Actually more than that. My math is a little bit on the off today. It's about 80% or so it has reduced. So और 2 बाकी, and probably he needs one more session to relieve him. We have given certain exercises for his low back, piriformis and hip joint to strengthen and to stretch, and then hopefully he'll get better in the next session. So thank you so much for sticking with us, and all the best to you, and thanks for again joining with us, and you know doing an educational and a research kind of a video for everyone to know. Much appreciated. And just so that you know, he's like a fast bowler for Bengal, and he's first division cricket player. So all the best to him, and so that he can be pain free in no time and do the best for our state and for our country. All the best. Thank you so much. Have a good rest of the day.